Emergency room nurses in Kentucky and Indiana are on the front lines battling the coronavirus pandemic. Focused investigative reporter Paula Vasan introduces us to nurses who explain how it has transformed their jobs, hospitals, and the way they care for patients.
Our rule is nobody dies alone.
Terry Foster says watching people die without their families has been one of the most heartbreaking realities of COVID-19.
I'm going to hold their hand. I'm going to pat their forehead. I'm going to be there with them.
He's been an emergency room nurse for 43 years at St. Elizabeth Healthcare.
I've never regretted one day of it.
But he says the last 2 months have been the hardest of his career. He's treated more than 100 people for COVID-19.
There was a lot we didn't know about.
He's seen 5 people die from the virus.
You're trying to do like 50 things at once with all of this garb on.
He says he counts himself lucky to have always had enough protective equipment, like gloves, face shields, and masks. The challenge, simply talking with his colleagues and those he cares for with his face shielded.
It's very isolating.
But then there are days like this. This is the 300th COVID-19 patient leaving Methodist Hospital on May 7th.
It's rewarding. We know that people are surviving and getting back to their life, which is awesome.
But for many hospitals, Patty Howard with the Emergency Nurses Association says they may never recover.
Because people really did stay home as we asked them to do and only came if they had to.
At University of Kentucky Healthcare, where she works, she says their daily number of patients was cut in about half to 150 patients a day, which means their revenue has been slashed too.
There have been areas around the country and in Kentucky that have absolutely furloughed a lot of staff.
And that's created a physical, mental, and emotional toll on nurses.
We all have a breaking point, and we have to watch that for each other.
A study published in late March in the medical journal JAMA found healthcare workers who treated COVID-19 patients in China often reported symptoms of depression, anxiety, and insomnia. Among those with the most acute symptoms, nurses. For resources for those on the front lines, head to WHAS11.com. For Focus, I'm Paula Vasan.